Hi, my name is Erica Sutton and my student ID is 3648426. This video is for the fall 2025 semester for the veterinary nursing class. Thank you.
Alright, so in this video I'll be demonstrating how to get an ECG on a patient. So we already have our patient in position. She's in her right lateral recumbency, which is the ideal way for them to be laying. And I have somebody holding her down as well. I also have the EKG machine, or our whole monitor machine, with the leads, and then some alcohol to spray afterwards. So I also have a blanket under her, especially if they're on a metal table. You definitely want to make sure that there's a blanket under them so that the electrical current doesn't get messed up by the metal of the table. So now I'll put on the leads. So we have 3 for our machine and they're all color coded. So the white goes on the right arm, so I'll put that one on her lower arm, and you want to do it just right above the elbow. You can clip it onto the skin. The black goes on the left arm, same thing, right above the elbow on the skin. And then the red one goes on the left hind leg. So that one's gonna be a little above the knee or the stifle. So now that I have all my leads on, I'm gonna turn on the machine. And then what you wanna do next to help it read is spray them all with alcohol. So you just spray the lead itself and then the skin around the lead with some alcohol on each one. So now that I have everything sprayed, it'll just take a moment for it to start reading. And my settings of the lead are also on, it's on lead 2, so you always want it on lead 2. So now you can see that her whole ECG is on there. I like to let it run for a second, and then I'm also gonna print out so that you could show the doctor what it looks like. So how you do that is you just press print, and it'll start printing a little paper on the side of the machine. I'll print a little bit so that we can see a few, and then you stop it. All right, so, and then on here, you can see what her ECG looks like. So we have the P wave here, the QRS complex, and then we also have the T wave. And this shows normal sinus rhythm for her. Thank you. In this video, I'll be demonstrating how to clean and disinfect a kennel. So our disinfectant solution that we use here is diluted kennel salt. So I have that, I have a rag to wipe everything down with, and then this is my kennel that I'll be cleaning. So first, you want to spray down every surface of the kennel, including the top. So I'll start with the top, and I'll spray down each side, including the cage bars as well. The contact time for kennel salt is 10 minutes. So now that I've sprayed everything, I want it to sit for 10 minutes and then I'll come back and wipe everything down. Now that it's sat for 10 minutes, I'm gonna wipe all the surfaces down with a rag. So when you do this, you do wanna start, you go from top to bottom. So I'm gonna start with the top of the kennel. That way any dirt and debris can fall down to the bottom. So that'll be the last area I wipe down. So now I just wipe down the whole top. You want to get every part, and then you wipe down the sides. And then you want to wipe out the bottom as the last thing you do so that you can get any dirt and debris that's fallen off of that. So now this kennel's clean, and then the last part I do is the bars. So I wipe down all of the bars as well. Sometimes they can get food on them or something, so just make sure that you're doing it well. And everything looks good. That's how you clean a kennel. In this video, I'll be demonstrating how to pill a canine patient. So I have my materials, I have what I'm gonna pill with, and then I also have some water to chase it down. So what I'm gonna do is somebody's holding the dog, and I'm just gonna, you kind of lift up their top jaw with your fingers and open the mouth, and then you can push the pill pretty far back, and then you can hold the jaw a little closed and just chase it with some water to make sure it actually goes down their throat. So as long as they swallow it and it looks like they got it and they don't spit it back up, you should all be good. In this video, I'll be demonstrating how to pill a feline patient. So I have all my materials here. I have a pill popper, I have some water, and then I have my actual pill that I'll be giving her. So what you're gonna do is I put my pill in the pill popper. And this one is a kind of a big pill, so it'll stick out a little bit. So that's what it looks like. Once I get it in the mouth, I push this and it'll pop the pill into the back of their throat. And then I'm gonna follow with water to make sure it actually goes down and it's not just stuck in their esophagus. So what I'm gonna do is I kind of grab her face like this. And there we go, good job. And then I'm gonna flush down with some water. Perfect. And then as long as they swallow and they don't spit it back up, they're all good. In this video, I'll be demonstrating how to do a nail trim on a canine patient. So now we have our dog on a table in lateral recumbency. They could be standing if it's easier. I have my main things that I'll be using, which are nail trimmers. I'll use their medium-sized ones. And then I also have quick stop. So if you cause the nail to bleed at all, you can stop it bleeding by putting some quick stop on it. So I'll grab the patient's paw. And I kind of like to push out the paw pad a little bit to push out the nail itself. And then I get my trimmers and I trim a little bit of the nail. So this one, I'm just gonna trim a tiny bit more, but you can see that quick right there, which is the black area. So I'm not gonna trim any more of that one. If you were to go a little farther, you'd make the nail bleed. So what you do is you just continue the nails and you do that on all of them. And along the way, if you make it bleed, you could just use some quick stop to stop it. In this video, I'll be demonstrating how to do a nail trim on a feline patient. This one is sedated. We have her on a monitor. She has her SpO2 on. So to start off, for cats, you do have to kind of push out their nails. So what you do is you push back on the top while pushing forward on the kind of like the palm of their paw, so that their nail is extruded. So on this one you can see she has clear nails, so that's the quick there. So what you're gonna do is just clip right above it. Right, and then you can do all of them like that. So again, I'm pushing it forward to extrude the nail, and then you just clip it like that. In case you quick one of them and go a little too short and it's bleeding, you would get some of your quick stop, and I usually pour a little bit onto the lid, and then you would just gently touch it to the nail, take out the nail and touch it and dab it on there, and then that would stop the bleeding.